Hey everyone, welcome. Thanks for joining today. We'll give it a couple minutes before we get started just to let people come into the room. Thank you so much for joining us.
Such a beautiful day today, Damien. I hope, after this session, everyone can get out and get some of that vitamin D and sunshine and kick off the weekend right.
Absolutely. It's a good day for it.
I just hope it stays warm.
I literally...
Awesome. So we'll give it another 15 seconds or so, and then we'll go ahead and get started. Thank you, everyone, for joining. All right, so we'll go ahead and get started. Welcome, everyone. Thank you so much for joining today. I just want to say hello. My name is Damian Leach. I'm the Youth and Community Engagement Project Manager at the Center for Community Health Improvement at Mass General Hospital. Welcome to our virtual Lunch and Learn, Redefining Access in Bipoc Communities to Heal from the Impacts of COVID-19. Thank you to our community partners and to all of our viewers in the audience who have joined us today. Today, you will hear a meaningful discussion about healing from the impacts of COVID-19 from Dee Dee's Cry and the Mass General Brigham Community Messengers. To introduce themselves, I'll pass the mic over to my colleague, Maswati Hanks, who will be moderating with me today.
Good morning, everyone. Almost afternoon. My name is Maswati Hanks. I'm from the Charlestown Coalition. I oversee our youth program called Turn It Around over there. I also do a lot of youth prevention work in the community and also substance use prevention work in the community. COVID was a tough time for our young people in Charlestown, and coming out of that, we've seen a lot of things, including mental health issues. And even just, physical issues from being isolated so much and not engaging in activity. So we're definitely excited to have a discussion with our partners about how they support their community members healing from the impacts of COVID-19. We'll have each community partner introduce themselves. And I think first we'll start with the representative from Dee Dee's Cry.
Hey, everybody. Hopefully you can all hear me. Happy Friday. And like Ms. Wadi, I can't wait to get outside and enjoy some of this sun. As you can probably hear, I'm not originally from Boston, so anytime there is sun, I'm happy. But my name is Dr. Brandy Brooks. I am here today. I wear many hats, but today I'm here representing Dee Dee's Cry as the Director of Operations. I am also the Director of Operations for the Roxbury Unity Parade, the only parade in Boston to actually happen during COVID. It was a camper van. And professionally, I work for Higher Ground Boston, which is a collective impact nonprofit. I'm located in Roxbury, Dorchester, Mattapan. We focus on educational outcomes, student homelessness, and health equity. And so I'm happy to be here, happy to share amongst colleagues and amongst all of you listening.
Awesome. Thank you so much, Dr. Brooks, for being here. Really happy to have you. Next, we'll introduce the Mass General Brigham Community Messengers.
I guess that's me here. So I'm Ephraim Flores. I'm a radiologist here at Mass General Hospital, also a health service researcher, particularly focused on health equity. I'm part of the MGH Equity Office Community Clinical Liaisons team under the Dr. Betancourt, Joseph Betancourt's umbrella, who's like SVP for Equity and Community Health. And I've been closely collaborating with Damien and Mass General Hospital and Mass General Brigham, the healthcare system in the COVID community outreach efforts. But I'm also, one of the things that I always tell Damien is like the trust and the relationships are longitudinal, because a lot of the efforts before COVID and after COVID and during COVID have been focused on increasing access to cancer screening. So I'm looking forward to talking, participating in the discussion today. We think about building a healthier and better future that is equitable for all.
Thank you, Dr. Flores. Chioma?
Hi, everyone. Great to see you. I'll take my mask off briefly. My name is Chioma Tomlinson. I am a physician assistant at Brigham and Women's Hospital. I have been in the Department of Primary Care for 10 years now. And so we spoke a lot with our primary care patients as far as how they've been dealing with the pandemic from the very start, and then also participated in the community messenger program to help folks that weren't directly linked to our clinic, but who also had primary care needs. And so really worked to help increase access to care and to figure out what people need in order to leverage the resources that we have at the hospital to bring them closer to where people are. So really excited to be part of the panel today.
Awesome. Thank you so much. And thank you all for your introductions. At MGB, we're committed to supporting our community as we heal from the impacts of COVID-19. Although the virus may be down, we know the mental, physical, social, and economic impacts of the virus still exist to this day. Today, we'll be discussing not only the outcomes we see in our BIPOC communities, but also highlighting the importance of increasing access to resources as part of the process of healing from the impacts of the pandemic. Today's objectives will be describing long-term outcomes impacting quality of life following COVID-19, determining ways to incorporate healing practices and self-care in participants' work and daily life, and applying strategies for engagement to heal from the impacts of COVID-19 outside of the medical realm, such as in policy and community domains. And I'll pass it back to my colleague, Damien, to kick off the questions.
Awesome. Thank you so much, Maswati. I really appreciate it. And thank you, all of you again, for being here. We're really excited to have both Dee Cry and the Mass General Brigham Community Messengers here live today. You know, for me personally, I've had the honor and privilege to be out in community with both Dee Cry and the Community Messengers. And I just really love the collective effort that we have, the collective vision we all share to really make sure that we not only build trust in our communities, but we meet our community members where they're at to provide high quality care in all the ways necessary, all the ways needed, from mental health resources to, you know, providing information, accurate information about, you know, the COVID-19 vaccine and different things like that. So this is just so cool to be live here with all of you today. So I'm going to go ahead and get started with the questions. The first question is, can you provide an overview of your work and how you address the impacts of COVID-19 within BIPOC communities? Dr. Brooks, I'll go ahead and kick it off to you first to open us up here.
Sure. So it's not an easy question to answer, but I'll do my best. So Dee Cry is an organization that Toy Burton, our founder and executive director, founded in 2017. It's named after her sister, Danita Shane Morris, who died by suicide at the age of 23 in 1986. And one of the things Toy talks about, and she's open about, is her own mental health struggles with depression, substance use and abuse, and it all really coming to a head for her. And the reason why the organization is named Dee Dee's Cry is because Toy felt when her sister was crying out, no one heard, no one listened, no one supported, including those in her own family, because they just didn't know. And so in 2017, when a friend came to Toy, and again, this was after her own years of struggles and things like that, and said, I'm struggling. Toy, do you know of resources? Are there any supports? And she did a survey of the community, and there just weren't enough supports that reflected the community. And so Toy being Toy said, you know what, I'm gonna change that. And I'm gonna create the organization I want to see. And so it was from that that Dee Dee's Cry was born. And I joined a year later as a director of operations, because at that time I was working for the Department of Public Health, suicide prevention program. And one of the things I'd always bumped my head against was that in suicide prevention and mental health space, it's often seen as it's a white problem. That's that community. That doesn't happen in our community. We're not crazy. I ain't going to see nobody. And so I was always bumping my head against that, because suicide is real. Depression is real, and it impacts every community, every demographic, every racial, ethnic group, right? It does not respect those boundaries. And so that is really where it was born, and out of that. And so one of the things we did very early on in the founding of the organization was have community engagement events. The Easter egg hop that would happen at Franklin Park. And then we started bringing folks together around conversations, mental health while Black. We had our first one at the bowling building, and then we had it at Grove Hall Library, and then COVID happened. like to every organization. And I mean, I see the head nodding, because you can't plan for that. You just cannot plan for March. You know, you get in a call, you can't go anywhere, you can't do anything, everything is shut down, right? And so of course it created fear in communities, it created anxiety. And you think about that, one thing we know in the mental health field is that you have more anxious folks, you have social isolation, and then, okay, so where are the resources to support folks as they're at home? And then coupled with that, particularly when we talk about young people, is you have environments where young people may not be safe. The home may not be a safe, supportive environment for them. And so what we did at Dee Dee's Cry was we said, okay, when COVID is impacting, but the work can't stop, because the impact was disproportionately impacting our communities in terms of economically, in terms of, the incidence of COVID, catching COVID, dying from COVID, and the statistics bear that out. So it was like, okay, let's just go virtual. So we just started hosting events every week, every month, just trying to get out information. Mental health while Black. Let's talk about where the resources are, where, let's support one another. Let's have a mental health while Black conversation around advocacy, because then you had, George Floyd happening. So it was so many things happening at the same time that we said, we have to find a way to continue conversations, to continue advocacy, to continue education. So we just moved everything online. Another thing we did with support from the Boston Foundation, we received a grant from the Boston Foundation. And so we said, how can we help the community? Because again, we want to help those in Roxbury, Dorchester, Mattapan specifically. And so Boston Foundation gave us some funds, and we literally gave out gift cards to folks. We said, just write us a simple sentence paragraph, tell us how, you've been impacted by COVID. And we sent out over 500 gift cards to folks, you know, like no questions. That's just, here's the gift card, support your family, do whatever you need, you know, whether it's buy groceries or whatnot. We didn't want to put a limit on what folks could buy for. So we just said, use it, support your family. And so those are kind of some of the direct ways we help. And we continue to do that with partnerships with Boston Public Health Commission, in terms of giving out kits. And we're also in conversation around creating a loss team, again, to continue. So those who've lost someone to suicide, how do we support? So we're constantly continuing to think about ways to support the community, because the bottom line is that our communities, with or without COVID, are still impacted when it comes to violence, when it comes to disproportionate impacts, when it comes to all these things. So we've got to continue the work and not have COVID just be a moment. This has got to be a movement with respect to how do we address mental health in the same ways we do physical, financial, spiritual health. So I'll stop there and let somebody else.
I wanted to add to that, you know, incredibly, I'm not going to add too much, but what you were saying, particularly at the end, it just reminded me that you know, a lot of the efforts now are looking upstream, right? So when we think about downstream effect of what we see in health disparity, particularly in COVID, right? So you underscore the impact of all these outside factors, social determinants of health, which are what we think about upstream, right? So when we're developing new programs or building a better future together, what is the collaboration? Like Brandon mentioned, it's about not only facilitating the mental health care, but also trying to assist patients in that journey outside the healthcare system, right? So that where it could be via gift cards or providing more flexible hours for us, like meeting patients where they are, not only with our community efforts, but also when they need us, right? Because it's not only we're not moving away from a prescriptive appointment, more so to through partnership with the community in terms of what a deeper understanding of what the community needs through longitudinal relationships. And this is not a one-time thing or a one-size-fits-all approach. It's just a matter of building trust, longitudinal relationships. So we're assisting patients in their journey when they're in our setting, I would say in the care setting, in the hospital setting. But care and health are not limited to the hospital, right? To the walls of the hospital. Health that needs to happen in the community. And these are incredible efforts like Didi Cry and like all the additional effort that we're moving in our community outreach efforts, or like community messenger, or collaboration with Java with Jimmy, or like with El Mundo, right? So these are like our messaging needs to be available when to meet patients where they are and when they need us. And we don't know when that is, but it's a learning process, and we want to partner with our patients because in the end, they are the ones that lead us in this journey.
Yeah, for me, working in primary care, we are with people to the very end. And so we see the good, bad, and everything in between. The one thing that we've seen in a lot of folks is after they get COVID, there's a significant amount of mental distress that happens, and it can last for months later. And so normalizing some of those thoughts and those feelings so people don't feel so alone has been, you know, part of my work in my clinic. The other thing that we're really trying to do is to make sure that we always are approaching our patient care with an equity lens. And so we have clinics that address these long haul COVID symptoms, but we know that the rates of referrals are different between BIPOC communities and white communities. So we're really advocating to make sure that when folks do have these symptoms, that we, again, make sure that they're connected with folks that can really help them, and then bringing folks into those spaces that are concordant and so look like them. The other thing that we're seeing as far as the availability of treatment is making sure that not only can we prescribe as primary care providers, but we're recognizing that some communities are at higher risk because of, you know, the structural forces that have led them into the circumstances where they are. So we're now now getting regular updates as to who is prescribing and who is getting these prescriptions, and making sure that we're always looking to see if we have a patient in a high-risk community, that we are starting to prioritize and make sure that they get treated as well. So that's part of, leveraging the resources that we have at the hospital to really make it work for people and advocate for those who aren't in our building, but who need our help.
Absolutely. Oh my goodness. This is such a cool conversation. Just listening to this, I'm like, how cool would it be if like we was to make these conversations accessible for other people out in the community, instead of just like in a virtual platform like right here, but like to be out in the community where, residents can, be around this conversation and listen in. And this is such a powerful conversation. One of the things that really resonates with me is how access to information is so important for it to be in the specific language that the community member needs it in. You know what I mean? Like for people who have limited English proficiency, for example, being able to have the right information in the right languages is definitely helpful. Because a lot of times we see trends in healthcare where it's kind of like a blanket kind of thing, and a lot of people are missed out because of that. Going back to what Brandy's point, Dr. Brooks' point about the care reaching the community and it reflecting the community, as Chioma had mentioned as well. So this is so cool, and I think that it's again important for community members to see these conversations happening, because you all are frontline workers, right? Like on the front lines, giving it your all every single day to make sure that the community is good. And so thank you so much for all the work that you do to make sure that people have access to the resources needed to get through the pandemic. And of course, a lot of the issues that we've seen before the pandemic have existed before the pandemic, right? But now it's like this pandemic has exacerbated, quote unquote, but it's like these things still affect us to this day, regardless of whether or not COVID was there or not. But the question that I want to ask is, what inequities do you feel have been specifically exacerbated by the pandemic? Like, how have these inequities impacted people's access to resources? Who is most at risk, and how can we close the disparity gap?
Small question, right, Damien?
Just throw it in there.
All right. Let's try to handle that. I'll start with this. Is there are certain things that a community needs to thrive, right? I mean, I think, when we talk about inequities or what it takes to have a thriving community, we'll talk about transportation. We'll talk about access to food, right? So it's not a food desert. You can get healthy options. We'll talk about, what is the financial base and structure in a community. We'll talk about what is the access to healthcare, mental, behavioral, physical, how long is the wait? We'll talk about all those things. Then you'll look at the school systems and, what do the schools look like? And then you'll look at the wraparound services and supports. And then you'll look at the overall environment, like the climate in terms of, is it breathable air? Is it, do you have high density zones with respect to heat maps, in communities, that type of thing. And so I think one of the things we see is that, again, pre-pandemic, there are certain locations in the city of Boston that historically have disproportionately been impacted and had less access to certain things, right? That is just a matter of fact. Now, what the pandemic did, though, was that I think it didn't say, oh, these didn't exist before. I think it just made it more glaring in terms of folks with respect to not being able to pay their rent because their job, they worked in a service industry and those were the first to be shut down. And, and so then there is the disproportionate impact there with rental assistance and things like that. When we talk about when the pandemic hit, there were questions around which communities were hit the hardest. You know, you had Boston, Chelsea, other communities, again, because you look at who's the population in those communities, what jobs, and so they were being impacted with respect to access to care. You know, do they have the same access to care, access to clinical care, access to behavioral health, access to physical care? And as particularly when you look at certain communities that have higher immigrant populations, is there that trust too with these systems of care? And so for me, what, and you know, Dee Dee's crowd, what we were seeing is that communities were impacted, and there were definitely lots of attentionality and focus and things like that. But I think the thing that we were seeing is even within those communities, certain areas had better access. So it was it was just disproportionate access all around. And then there's the question now afterwards, you know, as we're coming out of the pandemic, you know, we're wearing masks less and less, you know, in terms of mandates and things like that. There is the question around what is this going to look like? Because there's been more intentionality, more funding, more supports around making sure communities that were disproportionately impacted have supports. But the question still remains is, are we going to continue to see that? Is federal funding, state funding, city funding, is that going to continue? And that's why, you know, one of the things we're fighting for is that it not just be a moment, but a movement. And when we talk about access, I mean, I think that's important is, you know, and Dr. Chioma raised this, is with respect to access is, are we seeing an uptick in the numbers in terms of the percentages? If we say we want to be more equitable, are we doing that intentionally with our hiring practices? Are we doing that intentionally with, you know, our community advocates on the ground? Are we doing it intentionally? Not just a box we check and say, hey, we went to that training, but are we really intentionally saying, do we 5 years from now have a greater percentage of BIPOC physicians? Do we 5 years from now have more people sitting around the board tables making these decisions? And so that's where I think, you know, the conversation should shift to, is how do we make sure that this equity conversation and lens that we're in this moment becomes something that has a little bit more teeth. And so I'm sorry, I kind of started someplace and went someplace else, but it's really important in terms of mental health is that folks are struggling, communities are struggling, and I don't want to continue to have this same conversation 10 years from now, where we say the communities that we know were struggling in 2022 are still struggling today. And that's been something, you know, I've been in a lot of these meetings where folks are frustrated about, is that communities in Roxbury, Dorchester, Mattapan continue to have the same struggles around mental health and access and equity and da-da-da-da. So that's what I'd like to see, is the change there in terms of some of our organization around making sure we really are intentional about our efforts.
Can I add to that? I think Dr. Brooks just summarized it really nicely, and she hit a lot of key points that are critical for this. And as you were talking about, you know, word that came to mind, for example, like is sustainability, right? Sustainability in these efforts. We cannot think about going back because there's a lot of talk about, okay, we're going back to business as usual or usual care, but the business as it was, or healthcare, was not working for everyone, right? So it worked for a certain population, but there were many that were left behind. So when we talk about equity, I think about health equity being more as a vehicle for healthcare, and I'll work in the setting of healthcare transformation, right? So how do we improve the health and overall well-being of all patients, right? Not just to say, like Brandon was talking about, not only a checklist, or a check mark on the list, but all becoming part of the fabric of the DNA of everything that we do, infuse it on every single aspect of health moving forward, but also what COVID highlighted in the community and our underrepresented minority community who, were like, for example, a lot of them were working in essential job like the grocery store, minimum wage, working double job, 3 jobs, and they couldn't, multi-generational households where they couldn't isolate, or even if they catch COVID, coming with the stress home of, I gotta sleep in the couch because I live with 10 other relatives in like a 2-bedroom apartment, so just putting a lot of stress, and then also were a higher risk, and they didn't have the luxury of like using Instacart to order food or save food, right? Because they're living on a weekly paycheck, and they don't have the ability for remote work. So the pandemic really, what it created is a framework for us to think not only how social determinants or like the factors outside healthcare directly impact health outcomes, but also developing that framework to look upstream so we can create links between the public health sector and the healthcare sector. So there's conversation shifting more towards we call precision public health, right? Where it houses, and in the case for what I do is like lung cancer screening through imaging. So precision cancer screening, precision community health, right? Which is more like tailored outreach. And then but then what happens is that many times, or what I hope we do as we think building a path forward, is that we create stronger links for patients between healthcare and the public health sector. So when patients are discharged or stopped by our healthcare system, we may not be able to solve in healthcare, for example, in Mass General all housing, although, but we are able to provide a resource to connect patients with that can secure the housing or address food insecurity for the patient, connecting them with a local food bank. And then so that way we address not only the acute medical need, but also address the other acute present need that it may be equally or actually more important for the patient because of the implication not only for the individual, but for also those that are dependent on them. We don't want patients to being in a crossroad where they have to make a decision: do I take care of my health, or do I put food on the table for my family, right? So we want them to assist them in that. So that one of the reasons why I stress the importance of assisting patients along the journey, the whole journey, because the journey doesn't start when they come into the hospital walls. The journey starts before that. So how do we improve the health for the community so then patients can focus on their health and get all the benefit from all the advancements in medicine that we can offer?
Brandy and Efren, I just really appreciate you kind of taking us down this road. I think it's so important. I'll take the example, I think, Damien, that you mentioned of the low English proficiency. And so right in the beginning of the pandemic, when a lot of our visits were transitioned to virtual care, we realized that we did have an issue with meeting the needs of patients that had low English proficiency. And so a lot of the effort in the beginning was around increasing the number of print materials in different languages. And Efren, as you just mentioned, the patient's journey starts long before they actually come into the office. So from there, we looked at the data, and it wasn't a matter of just figuring out where the discrepancy was, but then affirming it and making sure that we did something about it. So we realized that it's one thing to have materials printed, but the other piece that we were missing was the verbal. How are patients being called for reminders of their appointments? How are they connecting with mammogram services to actually schedule that appointment? And so now there's a push to make sure that we're also putting equal efforts in how we communicate verbally with patients with low English proficiency to ensure that we can meet folks before and after their visit where they are. So I just really appreciate the acknowledgement that there are some communities that don't need to just be recognized, but we need to be intentional and active about what we do with that information.
Thank you so much. All of you made such powerful statements, and something Dr. Flores and also something Dr. Brooks said really stood out to me. Dr. Flores said, there's such a kind of push to have things go back to business as usual, and I feel as, health providers from the BIPOC community, we have a responsibility not to allow that to happen. And I wrote down, Dr. Brooks, when you said, we can't let this just be a moment, it has to be a movement. And that really resonates with me, and with our responsibility that we have as healthcare providers in our community, to make sure these things continue to be improved. The issues that were, spotlighted or exasperated because of the pandemic, we have to continue to push to make this change. So really powerful stuff. Thank you guys so much.
Yeah, I mean, one of the things I think about is, one of the things the pandemic highlighted to me is like, the more we progress, the more we rely on the old. And I say that in the sense of, I don't know about y'all, but when the pandemic happened, I was like, what am I going to do with my time? Like, what I'm going to do? Like, I can't just sit in the house. So I went and bought a bike. I don't even remember the last time I rode a bike. I was trying to find those things, those connectors, right? And so as much as we have Zoom, and, this has been a great space in terms of, mobility and access for some, in terms of getting on Zoom, it also highlighted some of the disproportionate access with respect to internet and broadband and those types of issues. And we can't just assume that everybody has that, right, at their homes. But the other thing I think about is that as much as we want to advance and move forward, we can't forget the just basics of human connection and how important that is in terms of connecting with our communities. And I elevate this in the sense that sometimes often the easiest things we do in our work is we will translate materials. We will do we'll have translation services at our meetings and our events and things like that. But that in and of itself does not mean that you will have participants come and be part of it. It really still matters that we are in the community and with community amongst one another in terms of making sure people reach out and have the services. There's always this, if I build it, they'll just come. No, it'll just be a building that I'll be like, oh yeah, there's something going on in there, but nobody ever go in it, right? And so at least that's what the pandemic showed me, is that it was almost like we had to get back to things that may have been lost in some respects with the increasing technology and things like that. Because folks were like, oh, just email. I remember somebody really saying to me is that I don't even want to check my email no more. Call me, pick up the phone. And so I think about that in terms of how will this change how we do our work and how we work in community with one another. And I hope things don't go back to the same, because I hope we do take some of the lessons learned from the pandemic and make change and advocate for new and different, while also still enjoying, bike riding and hopscotch and all of that from our old days. But that's kind of where it brings me to, is just thinking about how can we take some of these lessons and the examples that we learned from COVID to kind of continue to amplify the message going forward.
No, go ahead.
Yeah, I just want to jump in there and echo that, and I think not just for, community-based organizations, but like healthcare across the board, especially leadership in healthcare. I saw a comment in the chat, and I just wanted to read off Gladys Pachas, her comment. She's a community messenger who's also been out there with the community caravan, and she said, agreed, the work done by many community organizations and the impact on our communities should continue, not only as a movement, but it should be a systemic change in which community work is considered part part of the health system with clear indicators and goals with an assigned budget based on community needs. I completely agree with you, Gladys, and I think it's so critical for the organizational strategies across all healthcare institutions with regards to budgeting and the way things are done systemically should absolutely reflect the needs of the community. There shouldn't be two different strategies. The strategies should be linked together.
Yeah, thank you, Damien. Continuing this conversation, and maybe we'll start with you this time, Chioma. How can various individuals strengthen access to resources in the BIPOC community? I know I was just commenting on, us as healthcare providers really having this responsibility to, like Dr. Brooks brilliantly alluded to, not make this just a moment, but a movement. So how can various individuals strengthen the access to resources in our communities?
Thank you for the question. The one thing I've really been thinking about, especially in my work in primary care, is that stigma plays a huge role in folks' ability of feeling comfortable accessing care. So anything that we can do as individuals to decrease stigma and normalize the needs of folks and their needs as far as accessing care is important. So one community that I really worry about are those folks who are living in larger bodies. I think COVID-19 highlighted the fact that folks who are living with obesity, because it's an inflammatory state, do have an increased risk for a severe infection. But I think what happened was that was followed by conversations that perpetuated a lot of shame that these communities already feel. And that is a barrier for folks in accessing care. So anything that we can do to just say this is a biologic chronic condition. It's not just about willpower and determination, but there are genetic factors and environmental factors that play into the development, and it should be treated just like any other chronic disease. So understanding that different folks are living with different risk factors and making it such that we want to have folks feel comfortable in their environments, feel comfortable with their providers, and not perpetuate stigma that can really lead to dangerous outcomes. And so it just kind of really gets at me when folks are, well, I can't come to the doctor until I lose. I was like, no, we want to see you now. We accept you and we want to care for you right now. So I think anything that we can do, and the same thing with mental health, decreasing the stigma so people feel comfortable just talking about where they are. I think when it comes to mindfulness, everybody wants to be in the present, but only when the present is happy and good. So allowing folks to say the present is a continuum. And if you feel the feels, you will be able to not calm the ocean, but ride the waves in a more kind of compassionate way. So decreasing stigma around mental health and around folks who are living in larger bodies is something we can all do at any step of where we are.
Thank you so much. And I love the way you answered that question. I think stigma is rife within our community, and it's also directed at our community, right, in a lot of ways, but there's also a lot of stigma within our community, right, about just healthcare and especially mental health care. So thank you for answering it that way and providing that insight. Dr. Flores, same question. How can various individuals strengthen access to resources in the BIPOC community?
There are a couple of things that come to mind. One is that the relationship is bi-directional, right? So a lot of the times we put a lot of the pressure on the patient, right? So the patient needs to connect with the provider. We need to, we're gonna say, okay, this is a flyer, you can call this number. And we don't take into consideration additional pressure that the patient may have, plus the stigma, as you're saying, plus the trust building that is needed, right? So do I trust this new resource that I have not engaged before? Which is something that just results in increases the complexity of how individuals navigate this. So, I would say it's our duty. If we are for example, established provider, if we are a trusted voice for the person, help them do like a warm handoff, right? So we establish that connection. We build that trust, or at least start that process with them, so they don't feel they're alone in this journey. I wanted to also think about that a critical that we think of community organizations and our patients, or going out in the community as true partnerships, right? So when I tell patients, and when I talk to patients and I think about the patient journey, I say, like, you're the captain of the ship. I am part of the support crew, but in the end, I'm here to support your health decision, but I'm gonna do everything I can to do that. But in the end, I respect that autonomy. But what I'm trying to say is that I can't say what is best for a patient. My approach is not, it can't be prescriptive. It has to be inclusive. And I want us to move that we think about redefining healthcare in the future and building a healthier future, that our approach as a system and society needs to be inclusive, right? Where we truly form partnerships, that we don't, people say, I don't, there's no I in team, but there's me, right? So they're always the concern how it affects me, how it impacts me. But if we talk about partners, there's no me or I, right? So that's with true collaboration, and that for us to form true partnerships, these are built on trust, on longitudinal relationships. And I can't say what is best for the patient or for the community if I don't have an established relationship. So who better to provide what a finger on the pulse of what is happening in the community for me to provide a better service than a community partner. And so those partnerships are the key for us, where we're going to improve access to mental health. We're going to improve access to cancer screening, to primary care, and any new initiative that may be access to telehealth, understanding what are the barriers and how we can better connect with our patients, community patients, and like all of us need to come together to a table so we can co-develop these new ways of delivering care. Because Dr. Brooks mentioned earlier, one size does not fit all, right? So we have to be like really tailor approach. We can do frameworks, but each framework, there have to be the opportunity to tailor it to the specific needs and understand that the community needs are constantly evolving. That's also something that I think that we can be a little bit too rigid, and the vulnerability creates a need for us to be a little bit more nimble in terms of to be more effective in proactively addressing emerging needs that are happening in our community all the time.
Thank you. And I'm so glad you said that. I think, many in healthcare are a little hesitant to, I think, admit that yeah, sometimes we are a little too rigid, right? And a lot of times we need to evolve with the community's needs. So I love that you said that. Dr. Brooks, if you want to finish that question off about, how can various individuals strengthen access to the resources in our community?
So one piece I think is being able to advocate and being able to amplify. If we're going to go from an individual point, is that community members have to be able to advocate on their own behalf. And I've been in many situations where I have gone to things as an advocate for someone because they don't feel their voice is being heard by the systems, by the institutions. And I was in a meeting earlier this morning. It was my education focused. And one of the things brought up was there was a school committee meeting years ago where folks have been at, and it was about, a new superintendent coming in and, parents advocating. And one of the comments from this meeting was that they noticed the white parents standing up and pointing and saying, I demand, you better, you right? And any person of color that stood up would plea and say, could you please, would you improve? Can you improve? And so what that reminded them is that there is a sometimes stark difference when it comes to just general advocacy. at the community level, at the individual level. And so I was pleased to hear some of what Dr. Flores and, Dr. Tomlinson was saying in terms of being an advocate and, really being a community partner, because the statistics tell us that Black and brown bodies, when they go into institutions, just often aren't heard and literally have to go in with true, like, I'm about to die, before it's like, oh, we'll give you maybe some prescription or some medication. And so there's that component of it too, if we're talking about individuals. And so it's, how do we make sure to build up our community around being better advocates for themselves when these things happen? Something I always say, folks be like, oh, Dr. Brooks, I'm like, yeah, that's great. I worked hard, but you have a PhD too in your life and your experiences. And so it's, how do we get you to a point where no matter what your education, no matter what your background is, you're able to amplify your voice and people listen and hear you, particularly if you're in pain, you're struggling, you're dealing with traumas. And so if we're talking about individual, I think it starts there. From a systems, I think we have to have community partners, institutions, learning institutions, medical institutions, really invested in the community and coming to the events. I'm always pleased to see Damien, because I know it's going to be good. I'm like, yes, MGH is here. They showed up for the community. And I think that's important, is really creating better community, individual, organizational partnerships so that people do feel supported, and that, seeing Dr. Flores on here, it may open up avenues where folks say, hey, I saw him, he's an advocate, and so I'm going to send patients his way. Or seeing Dr. Tomlinson, this is important. This is where it starts, in terms of making sure those individual voices feel like they'll be heard because they see themselves and they hear their stories reflected.
I love that. Thank you so much. You mentioned institutions like schools, community-based organizations, hospitals. And I guess the last question, and, I hate that we're running out of time, and man, these things would be amazing too in person, right, Damien, and really being able to get into it. One of the things I always think, because I run a youth program, I really think through that youth lens. And one of the things we've been doing in our youth program is working with some elders within the community. And, COVID really impacted them in major ways. And, you talk about things like this, where it's great, you're getting the information out to people and we're able to talk to our community in this virtual way. But for the elders in the community, a lot of them didn't have the know-how to do the virtual stuff, didn't even have the tools as far as the iPads, computers, to even access virtual things. So I'm really hoping in the future we can definitely start to have these meetings in each of our communities in person, and really being able to address the various members of the community hands-on. So yeah, for our last question, so how can groups or organizations like schools, hospitals, community-based organizations better collaborate with the communities and residents around healing from the impacts of COVID-19? And I know it's been addressed, I think, throughout this process many times, but I want to, give each of you kind of one last chance to, kind of sound off on this question or anything else you want to talk about. And Dr. Flores, why don't we start with you this time, if that's okay. So, how can groups or organizations better collaborate with the communities and residents around healing from the impacts of COVID-19? Last chance to sound off this question. Anything else you want to go to? It's been a pleasure.
No, thank you for the opportunity. And I echo what you said. I would love to have the opportunity to have it, in person in the community. We'd love to do like a lunch under the tent, truly in the community, because I think that critically important, especially now that the weather is getting better. So, a good excuse to be outdoors as well. and while we're getting some food, I would love to do that as well. But there are a couple of things that come to mind to answer your question. One is what Dr. Brooks mentioned before, right? We can't allow this to be a moment just truly converted into a movement. I think that just sums up a lot of the how we have to see this moving forward. But also we have to focus a lot of efforts on building trust by establishing longitudinal relationship, right? So our community engagement is not a one-time thing. It's not I'm gonna do a clinic and then, oh, by the way, I found out you have high blood pressure, but I don't have access to a PCP or a cardiologist to treat you, right? So I'm gonna, that has to change. And not only we're gonna screen for that, but we're also trying to facilitate access for that to improve the health. But also when we think about how do we do this, right? So how do we engage with the community? And a lot of the efforts has to be through hope and hope for a better future, and how we build on that hope. Building on what is common, a common ground, right? So how do we come together? Because if we focus on the negative or what makes or divides us, we're never gonna move anywhere. We're not gonna move the needle in the right direction. And sometimes the narrative tends to be like that. So what we try to focus on, and at least on our efforts in communities, in where in cancer screening or COVID, is to come together with a positive lens, right? Optimistic, to bring up hope, but also to learn, being open, right? So it's just, we can come up with a predetermined agenda. It's important that we keep everything open. So we co-develop the agenda, that we learn from each other, and then we work together. That's then in those processes and in that journey, we discovered that we have so much more in common. And then we all want to focus on hope. And by identifying those elements that we can use to build together, and that's what is going to change and how we are delivering care and how we are moving towards a healthier society that is more equitable, that it provides additional opportunity within the healthcare system and outside. And I firmly believe that is possible, and we just need to focus our energies into that. But I'll stop there because I want to leave time for others.
Thank you so much, Dr. Flores. Chioma, kind of last chance to sound off. And the question is, how can groups or organizations like our schools, hospitals, community-based organizations better collaborate with BIPOC communities and residents around healing from the impacts of COVID-19?
And thank you again for having me. I think it's just been a great conversation. And Dr. Flores, I'll just elevate something that you said about being collaborative and approaching members of the community with curiosity. I think that when folks are in the position of administration or power, there's a sense that they're the authority, and learning is about kind of elevating their own status or their own kind of skill set. But also thinking about learning and being enriched by the people and communities that we come in contact with. And so always maintaining that curiosity and knowing, just like Dr. Brooks had mentioned, every individual is the PhD of their own life. And so allowing that person to be seen and heard in their authentic voice, and then using that information to make sure that we're meeting people where they are, I think is kind of what I hope for the world as we move forward.
Thank you so much. And, I love what you said and wholeheartedly want to just second that. I mean, allowing someone to be seen and heard in their authentic self. I think if all healthcare providers just kind of went with that basis tenet, I think everyone would be so much better off in our community. Dr. Brooks, you want to bring us home? Same question or anything else you want to go on? How can the groups in the community better collaborate with the BIPOC communities and residents around healing from the impacts of COVID?
Sure. I always joke we should pass around a collection plate today. But I think that I have two quick things. The first is we first need to be intentional about what is the aim, what is the goal. So, one of the things is we need to say, we want to do X. We want to make sure that we increase mental health counselors that represent BIPOC communities by 20%, and then intentionally work towards it, right? So let's stop having conversations about equity. Let's start actually putting real teeth behind, as a community, as a collective, as a collaborative, this is what we want to see, and work towards it. Have a goal and things in mind, put those in place. And then also, one of the participants sent a message around, once kind of we have this goal, so I'm going to kind of borrow some of what the message stated, we need to really focus on how do we get to the systems change, because otherwise we're just treating kind of the symptoms, but we're not getting at the root. We're not getting at the things that no matter what, if you're only treating the symptoms up here, you're only treating the branches or the wind, then there's always going to be those systemic problems. And so we've got to have clear indicators, clear goals, and a budget, people. Like, we cannot sit here and say to communities that are disproportionately impacted and don't have the resources now, oh, just fix it. What? And you assign no money. Like, come on. We've got to be intentional about this. Assign a budget. Let's set a goal and then let's work towards it. I'm originally from the South, right? So it comes out a lot is I be like, look, I don't want to talk about nothing. We need to march, we need to protest, we need to do something. But why we talking about it? We know the problems that exist. And so for me, I think what needs to happen is, let's take the lessons learned from the pandemic. So and think about what we did in a year and a half. Like, when people say it's impossible, no, it is. Boston is a very resource rich community. We may be access poor, but we are resource rich. And think about what we did in a year and a half. You had a vaccine, all communities vaccinate. We were at above the national average. Think about that. There was intentionality, there was focus, and there was effort, and everybody came together. And so we need to do the same intentionality, focus, and effort on these things. And one thing I think is important too, as we go around and we focus and we're intentional, we need to make sure that every single stakeholder is at the table. Because if not, one or two things are going to happen. Those who are not at the table will be on the menu and continue to be on the menu. Or those who are not at the table will think, oh, I need to create my own over here. But then there's always a problem. Do you have the same resources and the access and things like that? And so that's what I think, that's what I hope for. That's what I hope those who are listening want to strive and work towards. I mean, Dee's Cry, we're open to working with anybody, but again, moving towards an outcome. Let's stop talking about things and let's start getting things done and working in community and collaboration. And so I'm happy to be a part of this today. I'm glad we had this conversation. I hope we continue to have them, Damian. Just putting that bug in your ear. But thank you so much. I hope everybody has a good Friday, a good weekend, a nice, wonderful, warm weekend. And we'll see you back hopefully soon. And go to ddescry.com for more information. You can connect with us, with MGH, with others, but let's continue the conversation to actually moving the needle.
Absolutely. Much, Dr. Flores and Dr. Tomlinson as well. Thank you so much, Ms. Wadi, for also being here. I just want to say personally that, the work don't stop. You know what I'm saying? We're going to continue to show up and be in communities, build those bi-directional relationships We do this work with so much love. And I must say, you know, I saw that Toy Burton joined us as well, you know, and I must say that every time that I am at an event from Dee Dee's Cry, I just always feel so much love and always feel so welcomed. And we will continue to do our best to support Dee Dee's Cry. There's all different awesome events happening coming up soon, and we're excited for those events. And so just thank you so much, Dr. Brooks, for being here today and sharing your passion, as well as to our panelists as well. I feel like I'm like going off script and just speaking from my heart at this point, but y'all know me, I do that anyway. So, but before we wrap up, I just wanted to put a bug out there in terms of a quick note about the Mother's Day Walk for Peace happening. It's coming up soon. We're excited to join the Louis D. Brown Peace Institute's 26th annual Mother's Day Walk for Peace on Mother's Day, Sunday, May 8th. In the spirit of healthy competition, we have two teams, Mass General Hospital and Brigham and Women's Hospital, squaring off to fundraise. We are including a link in the chat for you to learn more about this important event. Also, as a heads up, please stay tuned for our next Lunch and Learn on April 28th. We're going to be talking about At Promise Youth. So be on the lookout as the Mass General Brigham Community Engagement Team will be following up with you with more details. Lastly, on behalf of the Mass General Brigham Community Engagement Team, thank you so much, everyone, for joining us today as part of our Lunch and Learn presentation. Enjoy the weekend. Bye, everyone.
Thank you. Thank you for the opportunity.
Everyone. Have a great holiday weekend. Take care.
Have a great weekend, y'all.
Thank you. Have a great weekend.